Firstly, this is the frontalis muscle, or the frontal belly of the Occipitofrontalis. So the frontalis muscle or the frontal belly of the Occipitofrontalis muscle. Around the eyes, we have the Orbicularis Oculi, Orbicularis Oculi. Around the mouth, we've got the Orbicularis Oris, Orbicularis Oris. Here we have the Zygomaticus Minor muscle, Zygomaticus Minor muscle. Under that, the Zygomaticus Major, Zygomaticus Major muscle. And below that, we have the Risorius, the Risorius. On this side, we can see the Masseter, the Masseter. On this side, we can see the Temporalis muscle. So this is the Temporalis muscle. And on this side, because this is deeper on this side and I have the Masseter removed, I can see the muscle in the cheek, which is the Buccinator. So this is the Buccinator. We can see the Occipitalis, or the occipital belly of the Occipitofrontalis muscle. So this muscle is the Sternocleidomastoid muscle. The Sternocleidomastoid muscle, sometimes shortened to SCM muscle. So hopefully it's pretty easy to tell in this one that this is the superficial side in this model. This is going to be the deeper side, so I see more exposed bone, like the ribs, for example. The main muscle of the chest, this is the Pectoralis Major muscle. The Pectoralis Major muscle. If I were to take off the Pectoralis Major muscle, I would then reveal underneath it the Pectoralis Minor muscle. So this is the Pectoralis Minor muscle. We have this large muscle in the upper back, which includes this area, and this area. So this very large muscle. This is the trapezius. The trapezius. It's called the trapezius because when I have this on both sides, I have a trapezoid, or a diamond shape. Here I have the Latissimus Dorsi. The Latissimus Dorsi. Latissimus Dorsi. This is the scapula. This bone here is the scapula, and this part of the bone here is the spine of the scapula. The spine of the scapula. And of course up here the acromion, or acromion process of the scapula. This sits above the spine of the scapula, so this muscle is the supraspinatus. The supraspinatus. Okay, supraspinatus above the spine of the scapula, which hopefully your intuition will tell you that this must be the infraspinatus, and you would be correct. So the infraspinatus, because it sits below the spine of the scapula, the infraspinatus. Just this triangle here at number 50 in this model, so right here, this section only, this is the teres minor. Okay, the teres minor. This is the teres minor, and below that here, that attaches to the front of the humerus, this is the teres major. Okay, teres minor, teres major, teres major. This muscle, if you look closely, it kind of looks like it has a serrated edge. This muscle is called the serratus anterior. So the serratus anterior gets its name because it looks like a serrated edge of a knife. Okay, so serratus anterior. Intercostal muscles are going to be muscles that are going to be in between the ribs. Now we have two sets of intercostal muscles that you need to know. We've got the internal intercostals, which are here, and the external intercostals. So let me show you what the difference is, because it's kind of subtle. There's a little line here in this model. This line, I have a little bit of a darker shading on this side. It turns out that the internal intercostal muscles are actually rotated in the body. They're rotated forward, and they're rotated forward, and they contact the sternum. Whereas the external ones, which would be here, that's this lighter color, I can see a couple little areas here, not many, and then I can see a lot more. So here's that darker one, that's going to be internal intercostals, internal intercostals. All the rest of this lighter color will be external intercostals. So it turns out the external intercostals do not make contact with the sternum. They're rotated towards the back, and they make contact with the spine. Whereas the internal intercostals make contact with the sternum and do not make contact with the spine. And I even have a place back here as well where I can see some of these external intercostal muscles. The internal intercostals are going to be the ones by the sternum. Everything else will be external intercostals. This is the rectus abdominis. The rectus abdominis. Now I have two oblique muscles in this region. One external obliques and one internal obliques. So which is which? So remember, this is the more superficial. So these are going to be then the external obliques. The external obliques. When I look at the deeper side of this model, then I can see the internal because it's deeper. So these would be the internal obliques. The internal obliques. So we have the gluteus maximus. The gluteus maximus. And I could point to either side. Okay. Gluteus maximus. The deltoid is going to be all this. All of this together is the deltoid. Now, if I just trace the outline of this, I'm going to make a triangle, or the Greek letter delta. Okay? And that's where it gets its name, from its shape being shaped like the Greek letter delta, which is like a triangle. So this would be the deltoid.